Hi, everybody. Good morning. I'm going to say something that's a little controversial, but we're going to say it anyway. Happy Pride. Also, serious Pride. First of all, I'd like to thank the Commonwealth Club, Michelle Meow. This is the third annual Human Rights Summit. And Michelle and I, this has been a passion project. Now, Michelle's done most of the work while I just kind of show up. And I really appreciate the staff at the Commonwealth Club for them hosting this. It always looks so beautiful and professional. And I'm really, really grateful that the Commonwealth Club makes this an important event. And I think that this is going to grow into a renowned world-class event over the years. That's our vision. I'd like to thank Hive Solutions. The people at Hive are the only AI company in San Francisco that supports San Francisco Pride and supports the Human Rights Summit, and I really appreciate that. I think that it's a shame that more of those AI companies should be investing in human rights for our community here in San Francisco. I hope that everyone here will show up on Sunday morning of Pride. I know that it's a difficult day. There's a lot of traffic. You know, am I going to go down there really and get in that mess? But this year, if you come to San Francisco Pride, it is a revolutionary act because it is sending a message to Washington, D.C., and we all know that there's a regime in Washington, D.C. that's very interested in numbers. And I would love to show them a record turnout on Market Street for the parade. We have speakers, we have panelists today. I'm backstage, back in the green room with some lovely, lovely people from San Francisco Community Health and the Human Rights Commission. And then later today, at the end of the program, I think around 4 p.m., I'm going to have a Q&A with our celebrity Grand Marshal. Harper Steele is here. She was with us last night, and I just can't wait to have that conversation with her, to talk to a trans woman that transitioned late like I did and put it out all on the line, like really so much courage to have done what she's done and to reach out to a lot of allies, and she's very, very important. So I'm going to get out of here. I'm going to run to a press conference, but I want to bring up my friend, kind of a mentor to me because she did San Francisco Pride before me. Please welcome Michelle Meow.
Thank you so much, Suzanne, and thank you for those amazing and inspirational words. That's why you're the executive director of San Francisco Pride. Welcome again to the third annual San Francisco Pride Human Rights Summit. When we started this 3 years ago, Suzanne had sent an email and said, what do we do to have a deeper discussion around the over 400 plus anti-LGBTQIA plus bills that had been proposed in this country? Well, 3 years later, it is absolutely frightening what has taken place. A lot of those bills have actually passed. There are many of us who are living across the country without access to basic health care and needs. Our community is under attack. We are being attacked, and not just from the local level, statewide level, even the national level, but scaringly, right through cases, even the Supreme Court have made decisions to reverse our protections. It is a scary time, but why we're here today is to take a lot of the education, the information, the knowledge, take what we have built over the last 50, 60 years in this country as a community, fighting for human rights, fighting for LGBTQIA plus rights, fighting for women's rights, fighting for our children, fighting for our families, fighting for our church members, spiritual leaders, fighting for our schools. Those are all human rights. So thank you so much for being here. We have a wonderful day planned for you right after this. We've got 2 panels. We're going to focus on LGBTQIA plus elders, Social Security, disability, and Medicare, Medicaid. I know that's a huge topic. We also are going to cover LGBTQIA plus families. We're going to cover LGBTQIA plus in tech, how this innovation that we also are a part of and that we've built, how we fit in the movement and not just being the innovators behind the scene. How do we use that for our movement? We also are going to talk to human rights activists. We also are going to have joy because queer joy is resistance. So please stick around. There will be lunch later. So, we'll make sure that you are fed. There's snacks. There's hydration. There's a rooftop up at the rooftop, duh. But it's a Zen garden. So if you need to Zen out, please take care of that. Gender neutral bathrooms are up on the 3rd floor, but use any facility as you wish, as you identify with. Last thing I want to say before we get started with the panel is I love y'all. Thank you so much for being here. And yeah. Without further ado, let's get our first discussion started, and let's welcome Chair of the Human Rights Commission, Commissioner Leah Pimentel.
Good morning, everyone. Happy Pride Month. I have the pleasure of introducing two amazing individuals who are going to serve as Grand Marshal for Pride. First, I would like to introduce Janelle. She is currently the Associate Director of Trans Services with the San Francisco Community Health Center, and she also is the current overall House Mother of the House of Chanel in ballroom culture. You can tell by her fabulous style. Additionally, she has helped ignite and capture culture, fostering a space of self-expression, resilience, communities that thrive, a haven for Black and Brown LGBT individuals, particularly transgender and gender experienced people. Yes. Thank you.
Thank you.
And our next Grand Marshal is Lance Thoma. I've had the great pleasure of knowing Lance for almost 20-something years. A fabulous individual and also my neighbor. But more importantly, he is the CEO of San Francisco Community Health Center, an organization that focuses and believes that LGBT individuals and people of color deserve access to and deserve equity in healthcare and access to all those. He has also had 20 years of nonprofit management leadership and deep commitment of LGBT, AANPHI, HIV and AIDS, and people of color community. He's also served as co-chair for 12 years of the San Francisco AIDS and HIV Providers Network. For the past 7 years, he was a founding steering committee of the California LGBT Health and Community Service Network, established in 2007. He has been the vice president of the board of directors, formerly known as the National Minority AIDS Council, NMAC, for the past 6 years, and also served on the board of CenturyLink, a member-based coalition for the LGBT community. He additionally serves on the California Commission on Asian Pacific Islanders American Affairs. Welcome. Yes. Today we're going to have a little discussion with our two Grand Marshals about health, equity, and how it all comes together. Let's start off with Janelle. Looking at your long history of helping the LGBT community, particularly those who are most vulnerable, what have been some of the most pressing public health concerns over the past year, and how does your organization and initiatives meet these needs?
Oh, thank you. Well, I'm happy to see everyone, and this is a nice, intimate crowd, so we're going to have a conversation, and I want everyone to feel involved in that conversation. When I think about some of the pressing issues that our community is facing, most importantly, is housing, mental health, and connection to healthcare accessibility. Our agency does a phenomenal job at providing these services, but when you think about the city of San Francisco and the state of California being so inclusive. And I am an implant. I moved here from Rochester, New York. I've traveled all over, and to see the needs around the world, the U.S. in particular, it's really sad. And to know that our administration is not looking at that from a full person, a whole person lens, I'm just very grateful to be a part of an agency and a community who understands the importance of these pressing matters and continuing to provide programs and resources for folks to be able to overcome those obstacles.
Thank you. Same question for you, Lance.
Pressing health issues. I guess where I am with that is we are in unprecedented times right now where our LGBTQ plus communities, our immigrant communities are just under attack. I remember I was on a panel here soon after the election, and we could see that happening, that gender affirming care was going to be the number one priority for attack, that immigrants and undocumented communities were going to be under attack. And we are just heartbreakingly and outrageously now seeing it play out in just horrific ways. And I just feel like, and that's a public health crisis, right? When we are seeing our communities, folks trying to erase communities, trying to dispose of communities, that is ugly and abhorrent. And as a public health community advocate, it is about us making sure that we are fighting back so that our communities and everyone that we hold dear, we're a sanctuary city here in San Francisco, and our trans communities and our immigrant communities, our queer communities are who we value and need to protect. And I feel like we need to do that and be a leader around that, because there are other communities across the country that may not have the same kind of values of San Francisco with the leadership, the state of California that my dear colleague Janelle was sharing, but we have to do it. There's no other way. If we're going to protect the health and wellness of our communities, we have to actually start to fight back against all these attacks that are coming our way in real time.
Thank you. Speaking on that, how have public health challenges for Black, Brown, LGBTQ+, and other marginalized communities, how have the attack on their health and their challenges evolved over the years? And can you share some examples of how your work has really been adapting to the changes? Like, especially now, as you've mentioned, communities are under attack, attacking gender-affirming care. It's been one of the bullet points in this current administration. So I would really love to hear how your organization and you are helping with these challenges.
Yeah.
You want to start? Yeah.
Well,
go for it.
The services that we provide, and I don't want to sound like a robot in a sense of the things that we're doing, but in regards to housing, in regards to healthcare, mental health, gender affirming care, like, we are very intentional about making sure that we provide these services to so many folks. And with San Francisco being a sanctuary city, we've seen an influx of folks moving here. So being able to have those collaborations with other organizations and make sure folks are safe. And TBNC, I'm always super proud of TBNC having the first in the country an unhoused shelter for folks who are gender nonconforming and trans. Historically, trans folks that have to go into the shelter system, the staff picks where they're housed based on what they look like. So to have a space where folks are still building community and feel safe, I think about that. That is one of my highlights. Our gender affirming services. I mean, we have Lance who is advocating for us in a way that is indescribable. You know, you are the most phenomenal leader, and I'm so thankful for you. But we're providing a ton of services, and we're continuing to, even when not giving the full opportunity. It's our instruction and our passion, and we will do this because it is a part of our mission and a part of who we are. And I think back to my earlier days when I transitioned many years ago, and we didn't have gender affirming care and services. Things were, under the table. So always being a resource and a bridge for folks in community, it's a part of who I am. And I will continue to do that whether there's funding or there isn't. But I'm super grateful that our agency and the city of San Francisco and our community here really fights for those folks that are not seen and that don't get the opportunities that most do.
Can I add?
Yes.
So I guess we have the good fortune, and I feel so lucky that I get to be on the stage with our public choice Grand Marshal, right, Janelle, and me representing San Francisco Community Health Center. But what I want to say is, Janelle oversees our Trans Thrive Center. It's a standalone resource drop-in center by the trans community, and it is a beautiful space where I feel like dreams are coming true because of what Janelle and her team are doing there for the community. And I guess I want to say that is how we take care of Black and brown queer folks, right? And I've been thinking back in this time of Pride where we are thinking about resistance. And I go back to Compton's Cafe riot. We talk about Stonewall Inn, but I'm like, no, go back to Compton's Cafe. That is right around the corner where our trans community rose up, fought against police brutality. And that's really ground zero for what becomes the queer movement. And so I just I'm holding that because I feel like that is what I need to remember, what the San Francisco Community Health Center needs to embrace, because that we owe a debt of gratitude to our trans leaders who rose up. And so that is what we are trying to do, like really learn from history to make sure that we are harnessing that everything we did through the HIV crisis, where Black, brown, gay, and trans folks were forgotten. We knew that our agency was formerly known as Asian and Pacific Islander Wellness Center, and why we existed is because APIs didn't get HIV. That was the going whatever. That's what people thought, and it was absurd. And we actually had to be like, no. You're not collecting data on us because you actually didn't even put us in a category. You put us in a category of other. We had to fight just to get seen and to understand that Asians and Pacific Islanders need to have HIV services, but we needed to fight for that. And then we needed to fight for Black and brown, gay and trans folks to get access to the resources. And so it's always been a fight. I feel like that if we've learned anything, this has always been a fight. We take nothing for granted because our communities are always the last in line. And what I believe is, especially at San Francisco Community Health Center, is our job, Janelle, me, all of our peers, is actually to say, no, that's not okay. We're going to put our communities front and center because this is what we deserve. And that, to me, is how we do our best to correct and do right by our communities.
Thank you, Janelle and Lan. And I really appreciate what you said about the communities and the perceptions and the miscommunication and how it impacts the needs and offerings for community. And there isn't a day that goes by that we don't see there's a cut for this, there's a cut for that. I believe it was yesterday, Stanford is now eliminating gender affirming care. So you're seeing one by one, all of these things being taken back. And we even have individuals from the trans community who come to the Human Rights Commission to share the struggles, whether it be housing, healthcare services. So with all of these cuts happening, how is this affecting the individuals who come to you for services? But also, what strategies have you guys come up with to try to protect the gay, trans, and Black and brown communities from all of these cuts to make sure that their voices are still heard, but they have those opportunities and access that they need?
Well, I can speak from a more grassroots perspective and providing a safe space, most importantly. We live in a world where folks are not paid attention to. They're being mistreated, attacked. not represented well. So for me, it starts at creating a safe space and assessing the needs of folks on an individual basis. We provide hot meals for our people every day, for our clients and our community members. So for me, it starts there, that homegrown assessment of what do you need. And with our leadership team, it then develops into whatever our strategy is and what that'll look like, and continuing to fight for the services and programs and healthcare needs of folks in our community.
I appreciate that you raised Stanford, because I'm kind of pissed off about when I heard that on the news. I was aghast because we knew that was happening at Children's Hospital LA. Mm-hmm. We've been watching this. Mm-hmm. And then to have it happen in the Bay Area, it was shocking to me, because gender affirming care, there's nothing that says you need to stop doing that here in California. Nothing. And I don't understand why folks are, and this is what I will say, is as soon as all these executive orders hit right after January 20th, like disgusting executive orders around diversity, equity, inclusion, and gender ideology, we saw folks starting to comply before they needed to. Mm-hmm. This sort of anticipatory obedience. And it was scary to me. But what I will say, what we did, we actually then took it upon ourselves, with the help of Lambda Legal, to actually sue the Trump administration. We had never engaged in litigation. It was not a tool in our toolbox around how do we engage the judicial system. But when we could see that an illegal act, and what happened was, as soon as those executive orders hit, some of our funding was stripped from us, because we got CDC funding around HIV prevention for young trans people of color. We were providing services, and Janelle and her team oversee this. We wanted to do it here and in Oakland. For the past 3 years, we've set this incredible system of care up for young trans people of color. And that funding was terminated. And it was, I didn't know what to do other than first being shocked, and then reaching out to community members across the country and realizing that a lawsuit was one route, and we explored it. And within a couple weeks, we were in a lawsuit against the Trump administration. And I just want to say, and there's no guarantees, as you know, with any of this, but just 2 weeks ago, our preliminary injunction, and it wasn't just us, there's 9 of us across the country, three of us, the AIDS Foundation, GLBT Historical Society, and we are 3 of the 9 in this lawsuit, and we got the ruling. We got the preliminary injunction that we were requesting from the judge. That judge ruled in our favor. And so there's hope around all of this that's happening, but I think we just have to stand strong and say that actually, no, you cannot do this. You cannot take this away, because all of our lives matter. Queer lives matter, Black, brown, but trans lives matter. They're attacking trans lives, and they will go after all of us, all of us. And so they will leave no stone unturned unless we stop them in their tracks.
Thank you. You gave a great example of how you saw something, you thought about it, you got upset, but we're going to work together and fix this. And that ties into my next question with the attack on well-being. All these things affect, when you see this in the news and you think, wow, this is going to impact my healthcare, how I was planning to live my life, what I was planning to do. How can community members, policymakers help partner with you to make a difference? Because it's really about everyone coming together. It's just not one voice. It's everyone being a collective piece in this puzzle to really make sure that individuals have that health care and the choices that they deserve.
Well, what I will say is, it takes a village. Right, we can do what we can do, but we can't do it alone. And I will say, I appreciate your introduction of me, Leah. I run I co-chair the San Francisco HIV/AIDS Providers Network, HAPN. And it is a membership organization of over 25 organizations in San Francisco that are committed to being part of the HIV service provider safety net. And we meet every month, we advocate, we work with our public health leaders in San Francisco, we work with our elected officials so that we maintain, we don't take for granted that the safety net is fragile and it's life-saving, and we need to fight for it. And I will say that just last night, we were at City Hall, not just Happen, but every single budget advocacy group. We were at City Hall. We were working with our elected officials. We were working with the mayor's office. We were fighting it out until 2:30 this morning. We were at City Hall. All of the budget advocates were there because we all care about a budget is, to me, a symbol of the priorities of a city. And so that budget has to reflect the needs, the priorities, and it has to take care of our most vulnerable folks. And that's what we were there fighting for. And I feel like that's in the fight. There's also the relationships that we build to make sure that we are building relationships with our elected officials, with our board of supervisors, with our public health officials, with the mayor and his team, so that actually they hear us and they do right by us, right? And there's never like one person wins. There's always a compromise, and we got to figure that out. But we got to make sure that the needs of our communities are prioritized. And this is what we learn, right, in San Francisco. And we do that at the state level. We're doing it at the national level, and that's part of the work. You know, we just have to continue to do that. That's part of what we have learned at San Francisco Community Health Center, what I've learned as part of our ethos. It's like you can do good services, you can do good work, but when you start putting your money where your mouth is, when you start hiring the folks that are from those communities, when you take care of those folks, when you have to when you prioritize those voices and bring them to the leaders so that the leadership hears, so that they prioritize and hear what's going on the ground, that is what needs to happen. The good work alone is not enough.
Yeah, just to add to that, you know, showing up. You know, I think a lot of times as a community, we always want to celebrate the joyous times, the fun times, the prides. But I think it's important that now more than ever is that we show up for each other in solidarity, stopping by centers, checking in, simple kindness to folks that you see on the street. I think is so important now more than ever. So I encourage everyone here to continue to be kind and show up in the best way that you can. Yeah.
Thank you. I agree. It's very important that representation matters, but also they're the constituents of those policymakers. And for them to see these are the individuals that we're representing, our decisions are impacting their day-to-day lives, the health care that they receive, where they get their resources. So seeing that is so impactful. They often say a picture's worth 1,000 words. And each of you here today, you have a voice. I would encourage you guys all to think about how can you be an active member in this fight that's currently going on. My next question is, how do you see cultural expression and community spaces contributing to the healing and contribution to public health for the Black, brown, gay, and LGBTQ plus community?
Oh my goodness. So visibility is super important. We were actually just having a small chat in the back about, you know, what it looks like to be inspired and empowered, whether it's through your healthcare or, you know, through just existing, especially as a trans person. So when you go into a place and you don't see any representation of yourself or what you look like or your culture or lived experience, oftentimes you don't feel like that's a space for you. So it's really important that people get the opportunity, if you are in those roles, to have as much diverse imagery and cultural inclusivity in a space. So that way everyone feels warm and welcome, and they know that they're there with the ability to access whatever the service is or whatever you're providing in that space. And I say whatever, meaning from a healthcare organization standpoint to a coffee shop. It's really important that we make sure that there's expression for everyone and that folks feel comfortable. So.
Yes, thank you. So you both are the Grand Marshal. What would you tell your 15-year-old self if you had to look back? What would you tell yourself? And those words of wisdom would you share to the individuals that are here today?
I'll let you go.
My 15-year-old self knew I was queer, but totally closeted. You know, gay Asian boy in Hawaii. And scared. Didn't know what that meant. What I had no idea. But what I will actually, when I became 15, when I turned 15, I could get my work permit, and I worked at Burger King, and I made a really amazing group of friends. And my bestest friend there was a trans woman who was working there so that she could go through her gender affirmation and her transition. And I learned so much from her. And I'm just like, I was like, wow, okay, there are brave people in my on my island of Oahu, right? And so I was like, so what I would say is like, you know what? There are incredible folks who are doing their best to live their best lives, their most authentic lives, and create community and belonging that will welcome the queer 15-year-old into their fold. And there is a community of belonging for you. And I have worked my life to ensure that we do that, that we can embrace all of those folks who are feeling like they don't belong, and to actually welcome people into a space of belonging. I didn't have that until much later, but I have lived my life to ensure that young people, that was what my start in the LGBT movement was, to ensure that young people never have to feel like they are unworthy, that they don't want to live. And all of that, we're going to affirm folks and create spaces to ensure that, and we're going to fight for that.
I think that was an amazing story of how one person that you just didn't think you were going to interact with or meet to share the story made you feel not alone. Mm-hmm. And that really had a positive effect on who you became and what you did. So you got to thank Burger King.
Yes. And Madonna, my friend at Burger King.
Oh my goodness. So when you just asked that question, I was collecting myself, because I asked myself this question probably monthly as things change and as I evolve. But most importantly, I would tell myself that you can do anything that you put your mind to. And it sounds cliche, but I come from a very poor, I'm the first person in my family to go to college. With a trans identity, who didn't have the verbiage around what it meant to be trans, or even the support or network. And I had to navigate a lot of things on my own and through community. And, hence why ballroom is so important to me. Ballroom has been something that we've created our own families in support, and through network, and through sharing resources in a way where they weren't as mainstream. So just thinking back to that 15-year-old girl who needed so much help and was so confused, but very driven, I would tell myself that I can do anything. And I am still floating on cloud nine, being here, having the opportunity to represent my community in ballroom and through community health and trans visibility. And there's so many intersectionalities and identities that I possess. And to be able to represent that in the parade this year and for my community, I am literally living out what I would tell my 15-year-old self. And that is, you can do anything.
Thank you. Looking back on some key lessons from your work, what do you believe should be some key approaches for community health and social services moving forward?
I'll jump in. Collaborations. I think it's very important in this current atmosphere and with everything happening with the administration. In the pulling of funding, we realize, well, some realize the importance of collaborative efforts and us coming together, brainstorming on ideas on how to roll out programming or how to continue the care. And, you think about San Francisco Community Health when COVID happened and going out and meeting the folks through street medicine and still being able to provide care for folks that aren't able to come in. You think about those collaborative efforts. And I think that's one of the most important things that I'm taking away from this current vibe or atmosphere is how important it is for us to be together, how important it is for us to advocate for one another and stay in connection and collaboration. So it's the first thing that came to my mind when you asked that question because, it's such a beauty in us coming together. I think in similar work environments or work fields, folks kind of feel like, okay, this is this is them, this is their thing, but we all have a similar mission, and the mission is to make sure that we provide quality care for folks in our community. So coming together has been really, really, really beautiful, and getting an opportunity for everyone to kind of show up and thrive.
Yeah, I think, well, for me, there's a lot of lessons learned, throughout at San Francisco Community Health Center. But a couple things is that, we really try to think outside of the box. We're constantly pushing ourselves to think about how do we be innovative on behalf of the communities we're serving. And Janelle mentioned COVID. And I think we learned so much. When COVID hit, I think it was March 17th, 2020, they were telling us to shelter in place. That is what our mayor told us. And our clients who are homeless had no idea. What does that mean to shelter in place and to have 7 feet, whatever many feet distance from one another, and no one knew what it meant to transmit or to contract this scary disease, this virus. And we sat in a room for a moment after we were like, I don't know, what do we do? Folks are gonna go retreat to their homes. We actually called everyone into the office, into our health center. And we're like, we have to take care of our people out in the Tenderloin, on the streets, in SROs, in their shelters or whatever. And we actually had and all of our staff did it. No questions asked. And we never shut down. We never worked remotely. Everyone was out there. And, and then we just learned. We actually figured out. We actually engaged folks who were homeless and struggling with substances. We engaged them to actually, everything we learned on a daily basis, we just passed on to our community. And they passed it on to their community. And then when the testing happens, when the vaccines happen, we actually rolled it out with the community. And we got the Tenderloin 90% fully vaccinated. The first neighborhood in San Francisco to get to the 90%, and that was inclusive of our homeless community members. Wow. And so, I am so proud of that. And that was about collaboration. It wasn't just us. It was with Glide. It was with UCSF. It was with DPH, with Curry Senior Center. We all worked together. And then we were like, you know what? We have these, places you could get tested and vaccinated. But actually, if you're homeless and you're just maybe a block or two away and you have all your stuff there, you can't just walk away from all your things and then go and wait in line to get a test or a vaccine. But folks wanted it. So we just actually took our whole thing and we went to everyone, We started doing that, and that is our ethos. That is what we do, our street medicine program. If folks can't come to our clinic on the 4th floor, which is not easy, We go to them. We have teams that go 5 days a week, 2 teams that go, medical providers, phlebotomists, social workers, case managers, eligibility specialists. We go there. We deliver results, test results. We help people navigate the system to get to their care appointments. And so that is what we do. And I feel like that is what we all have to do. We gotta get out of like what is always maybe what we expect or the norm, break out of that. Because actually if we're gonna take care of the communities in the best way that we can, we have to think differently and be creative. Always.
Thank you. I love your out-of-the-box thinking. You really addressed how there's the way things have been done, but in times of crisis, that outside the box thinking and creativity really implements and drives creativity. So what would you say are some innovative approaches and partnerships that really help address the health disparities within the communities?
So what I will say is, I'll think of something that I can think of off the top of my head that I see as such a great program that we provide at 1460 Pine Street is the She Boutique. You know, She Boutique and Folk and Swagger is we partner with community members to donate clothes, and it's not just a clothing closet, but it's an opportunity for folks to come in as long as you're accessing healthcare. Through any of our programs, you get an opportunity to shop. And we have partnerships with Banana Republic and Old Navy and Gap. So they're new clothes, and Sephora donates makeup and healthcare, beauty needs for folks. And to see people who don't have an opportunity to go into stores and feel comfortable shopping, or don't have the resources to go into stores and feel comfortable getting a bra fitting done, or, getting clothes, as long as they're connected to care, they get that opportunity. So it's the gift that keeps on giving through innovation. And that program, I watch on average monthly, 70 to 100 folks come in and get clothes that are able to then apply for jobs, or they feel comfortable going to events or school, and they're still connected through healthcare. And it's just like, it's the snowball effect. You get to see things from a whole person approach, and that collaboration with Gilead and that collaboration with Banana Republic and Old Navy and Sephora really helps folks in our community thrive. So it's one of the innovative ways to connect fashion and healthcare from a holistic approach.
Oh, I love that, because if you look good, you feel good. And I love color and clothes. And when you put on that poppy jacket or that suit, you're like, I feel good. And when you feel good, it impacts your well-being and your health, because it's all connected. So that piece of clothing ties into your health and your well-being. So I really love that story.
Magical. Yeah.
Thank you. What would you say, how do you feel about being Grand Marshal? How did you feel when you found out, and what did that mean for you?
For me, I am still floating on cloud 9 and super surprised. For me, this work is my passion. And as an overall mother in ballroom, I do this for my children. So to be recognized for my work on such a huge level and platform, I'm just so honored to be in this position, and I want to make sure that I'm doing my best and I'm showing up for folks in my community. But I'm floating, I'm floating, and I'm happy, and I'm honored, most importantly, to be able to be the representative for the people that I serve, and that they see that in me. We often don't get an opportunity to see ourselves how other folks see us. So this was one of those mirror moments where I got to see how my community sees me. So I'm living it out. It's been a magical week, and I'm so excited for Sunday to be in the parade and to get an opportunity to march now more than ever, with everything happening in the world. So I'm honored if I had to break that down to one word.
Thank you.
Yeah.
Leah?
I mean, and so, we are the organizational Grand Marshal. And so when I got the call from SF Pride, I screamed out loud because, it was about people voting, and the community voted. The community voted for Janelle as Grand Marshal. But what I will say is, who couldn't be here with us is Tita Ida, who's another one of our colleagues at San Francisco Community Health Center, who's our lifetime Grand Marshal. And then on the ballot, there were two others of our team members. And so it just felt like, it was like, wow, I just was so excited that our organization, but the people of our organization were being seen and applauded. And so when I heard that, I got a little bit of a forewarning, about Janelle and Tita. It was just overwhelming. I was like, whoa, we hit the jackpot. And why not? We've been doing such amazing work. Janelle and Tita and Kiki and Kailin, incredible, right? And so it's just like, I'm just grateful. I'm always grateful.
Thank you. Now we're going to open it up for questions from the audience. So if you have any questions, please raise your hand and Michelle will bring over the mic. There's one up front.
All right, before we begin our audience questions, just want to preview you for the next hour here. We have a global panel that is going to be right here in the Toby room. In the downstairs Remby room will be LGBTQIA plus elders and seniors. So just wanted to make a note of that. Question.
Hi, so thank you for all the wonderful things that you've said today. And my question is, what would you say to people who maybe and I guess I'm just talking about my own experience here. I'm neurodivergent, and for a while I closeted myself because I couldn't understand how could I have more than one marginalized identity, more than one so-called minority identity. What would you say to folks who are kind of struggling with that intersectionality a little bit? And I know you sort of evidenced that in your coming out journeys, but what would you say, to people like my teenage self who might either be overwhelmed by the lack of sort of traditionally embraced identities that they have, or to people who don't understand what intersectionality means in terms of the queer community?
Well, for me, I would say, and less about saying and doing. I have a phenomenal team of folks that I work with, and some of them are neurodivergent, and I learn a lot from them daily. I empower and implore folks to educate yourselves around those intersectionalities and know that it's okay, and be patient with yourself. That's what I would tell the younger version. But I want you to know that we're all family, and we're all a part of a community that's dealing with our own challenges and whatever that looks like. So you are loved, you matter, and be patient with yourself.
Mm-hmm. Yeah, and all I would add, because that is everything. You took the words out of my mouth, but what I would say is that as there's two sides of this coin. Intersectionality is complicated, right? To live at these intersections with identities is not easy. But what I will also say, it is your strength and beauty. That is what I feel like creates our queer community to be actually even more complex, beautiful, and powerful. So that is what I want to say, is I want to embrace all of the intersections that our communities and their identities, because I feel like that is how we're going to get through this. That is our power.
We have another question.
Here too.
This is a question about the budget process itself. And I know with our new mayor, he's made many changes in staffing at the high administrative level, including the Human Rights Commission. So I'm just curious, this is a process question, I guess, for you. You were up to 2 a.m. this morning at City Hall. Who is it you are now dealing with on budget priorities? Human Rights Commission, someone from the mayor's office, someone from Board of Supervisors? Give me some detail about that.
Sure, I can just give a little bit of that. I think at this point, yesterday and into the evening was when the board comes to their approval, or the finance committee of the board comes to their recommendation of the budget based on what the mayor has put out. And now there was a lot of negotiation. And so now the Board of Supervisors has come to their budget. And so now then it has to go back to the mayor and they'll figure it out. So at this point, of course, nothing's over till it's over, right? And so there will still be continued input and advocacy to ensure that the mayor and the Board of Supervisors get it right on behalf of the communities that we all care about. So it's not over, but it was a pretty significant moment, yes, at 2 o'clock in the morning when the Finance Committee did come to, with community alongside, when it's all compromised. We weren't happy, but at least we were there. We voiced what we needed to voice. The board wasn't happy, but we're all trying to move it forward so that we can have we are resourced for the needs that we need to be facing over this next year. Thank you.
Thank you. And we have a question then in the red.
Okay, my question kind of centers around creating solidarity among different communities. And so I think something that you guys were mentioning is working with intentionally working at intersections, with homeless communities, with all of these different things, I think. And then especially around kind of the public conversation and the who is involved in the movement and who isn't. I think what suggestions are, maybe not suggestions, but practices do you guys use or prioritize to create solidarity from people who might not initially think that they're invested in the activism for LGBTQI people? Yeah.
Well, really simply, for me, it's having those teachable moments. So many folks, have opinions or come in with their own bias around different identities or different cultures or different lived experiences. So having those teachable moments, giving folks an opportunity to be educated and empowered around what things are, I think gives you an opportunity and a different lens or perspective to gauge your level of involvement or how much positive change you're willing to create. But I think it starts with just having some kind of acknowledgement around what am I advocating for? What am I trying to change, or what do I want to be a part of seeing succeed in some capacity?
What I'll add is I feel very lucky, actually, as hard as things can get across movements, I think is what I hear your question, and I'll say even this budget process is, we are actually working alongside various movements together, right? We're together. It's the HIV, it's the queer, it's the women's, it's the homeless service providers, it's the human services network, disability justice, it's the legal groups, it's the neighborhood groups, the family services groups. We are all coming together to actually fight for each other. And that's actually pretty phenomenal. Because what I will say is, at a national level, it hasn't been like that, in my experience. And I serve on several national boards, and what we are doing really hard right now is we cannot afford to be pitted against each other. And so right now, even more so, we are really trying to ensure that sort of communities of color and and sort of all these different sectors and coalitions and movements, the repro movement, plus the queer movement, plus the Black justice movement, women's movement. We're trying to bring everyone together so that we can be like, we cannot right now. People want to pit us against each other. And we can't afford to let that happen. And we got to do the work to make sure that we are united more than we have been. And so I do see this happening more right now. And I'm hopeful.
Thank you. We have one more.
Two more. Three
All
more.
right, one more question, and then we're going to break out. Remember, LGBTQIA plus elders is downstairs in the Remby room, and then for those who want to stick around for the Global Pride Organizers panel, we'll be up here.
Hello. Also, very great answers all day. I have a very specific question because I'm currently getting my MPA. Mayor Daniel Lurie has proposed to break the cycle of poverty and homelessness, but as we see in recent times, he has been trying to amend the budget to cut TAY services and to cut other homeless services and replace them with emergency shelters, specifically in Bayview and in Tenderloin. How is your office specifically combating that, or are there any collaborative efforts with homeless initiatives to combat what he's trying to do in San Francisco?
Do you want me to? Yes, we see it's a complicated picture right now in our city. There's so many issues. For San Francisco Community Health Center, we are embedded in the Tenderloin, but we of course serve folks citywide. So we care about ensuring that homeless communities, substance using communities, trans communities are prioritized. And we have seen that, at least in the work that we're doing, the shelter, we run an emergency shelter. Janelle was mentioning Taman Bhutan Navigation Center, our Trans Thrive Resource Center. We are those services have been prioritized. And so I really feel like we're going to do more. We want to do more with the city. In addition to what you're hearing, they're expanding access to behavioral health services, psychiatric services, substance use services, and we're part of that network. And so I just want to say we're going to do everything we can to reach as many folks. And so we do feel like we're going to partner with the mayor. We're going to partner with his team. We're going to partner with the Department of Public Health, the Department of Homelessness and Supportive Housing, and ensure that we do this together. And not to say that there's going to be pain, because cuts have been made and more cuts will have to happen. We know that, but our hope is that we work together so that as we have less revenues over time, that they are working with us to make sure that we're giving input and they are listening to our feedback, because we're on the ground and we're seeing what's needed. And so if we can be a part of those conversations, then we can also then be creative, think outside of the box, and help to adapt and make sure that our communities don't suffer.
Thank you. I'd really like to thank Janelle and Lance for joining us today.
Thank
we
you.
really appreciate your answers, your wisdom, and your guidance in this interesting time that our country is in right now. And I want to thank all of you for coming today.